there is a lack of resource, expert resource, and I think we see that in a number of areas. So the obvious example at the moment is the debate around setting Valproate, and really still a feeling that some women have not been getting the advice that they should about the drug, the impacts of it, the teratogenicity. And now, of course, we've got emerging data about men and whether there may be a problem there, transgenerational risks and so on. And when you do have people taking that drug and the number of specialists available to counsel, you do the maths and you start to find that you've tied up almost the whole of the epilepsy nursing workforce in the UK just trying to counsel those people. When you add in things like risk factors, sudden unexpected death, and looking at risks rather than just a blanket sort of statement of, that seizures can be life-threateningly dangerous. When you actually try to drill that down and apply it to an individual, it takes time. We have another big group with women who are pregnant, and there was the recent Embrace report highlighting a rather dramatic increase in maternal deaths of women with epilepsy. So again, careful management through pregnancy is really important. And close to my own heart, I'm a learning disability nurse by background, although I've worked in neurology for nearly a quarter of a century now, which makes me feel really old. We have particular challenges in that cohort. And I think this is where artificial intelligence sort of coming full circle can really help us with diagnostics in people who really find it very difficult to tolerate our standard battery of tests such as EEG, MRI and so on. But actually supporting that group of people, I think, is very important. Again, there's a mortality risk. If we look at the recent LEADER reports, epilepsy is being highlighted as one of the biggest risks for premature mortality in people with intellectual disabilities. And there are very few joined up services. There have been a lot of moves to try to address this. An excellent document called Step Together in 2021 was really highlighting the need for learning disability services, intellectual disability services and neurology to work more closely together. I run a joint epilepsy and intellectual disability clinic, but again, I think, and a couple of colleagues do, but I think we are the exception rather than the rule with that as well. So there's a lot of need out there.